Hi, everyone. I think we can begin. We have a number of attendees on the line. So good afternoon and welcome. Thank you for being with us today. We've hosted these events. I'm Effie Battis, by the way, from the Audacia Foundation. We've hosted these events for home care providers. We're happy to be back. A lot has gone on in the last few months and related to COVID. So we're going to do the best that we can today to bring you all of the updates. We have invited Frisch back, who was with us for the previous webinars, to come to speak to you today to inform everyone about what's going on. We've left some time at the end for Q&A. Anything that we can't answer, we will try to get that information answered and get your questions answered. So with that, I would like to turn it over to Anne. Thank you.
Good afternoon, everyone. Can you hear me?
Yes.
Great. Thank you, Effie, for that introduction, and welcome, everyone. I guess when we last spoke, it was in June, and we had anticipated that we might have some smooth sailing and things would begin to settle down. But unfortunately, it looks like things are kicking up again. And although there is some hope on the horizon with some vaccines coming forward, we're really in the midst of a situation similar to what occurred in the early spring of this past year, although we have a lot more knowledge about the disease or the virus and how it should be treated. So we're hoping that that information will allow us all to fare better as we move forward. As Effie had said, this is an information update for home care providers, and it comes based on guidance from New York State, the Department of Health, CMS, OSHA, and CDC. The information is rapidly changing. When I went back and I looked at some of the information that we shared early on, it just went to show us how much we thought we knew, but we really didn't know because so much of that has changed in the past 6 or 8 months. I'm just not sure why. Okay, here we go. So these are our objectives for today. Again, like I said prior, we will be giving you the most recent updates that we have. We're going to share resources with you on the New York City PPE Stockpile initiative, discuss online learning resources available through the Audacia Foundation, inform all of you about a pilot mental health program being offered to AIDS and LICSA administrative staff that is sponsored by Audacia for restoring and building resilience in AIDS, and also our coordinators and administrators during these difficult times. And as always, we find that the most important part of all of this is getting all our providers together and encouraging you to share your best practices and lessons learned on sailing through this very difficult time. Originally, we were going to do this in November, but we had to reschedule. So I would be remiss if I didn't wish everyone on behalf of Audacia and myself a very heartfelt thank you for all the work you have done, and particularly during November, as we look to all of you as celebrate all of our home care workers and all of our own home care agencies during National Home Care Month. So we know that we don't say it often enough, but thank you, thank you, thank you. You've all done a yeoman's job in facilitating care and maintaining care and services while taking care of your staff and each other during this very difficult time. In terms of one of the updates, and some of this may not be new information for you, but for others it may be. So I want to make sure that in the midst of everything going on, that no one has missed very, very important critical information to maintaining compliance in your organizations. So we all know that back in April, the annual health assessment was suspended for our home care providers, but effective in October, the suspension was lifted and personnel are advised to obtain an annual health assessment no later than December 31st of this year. So based before the end of the year, the recommendation is make sure if anyone is behind on their annual health assessment, that you get that documented. Pre-employment health assessments for all personnel, including TB screening, documentation of immunity to measles, rubiola, and influenza status were not waived. And flu vaccine or wearing a mask is still required under regulation. Now, also early on in the pandemic, the home care aid in-service requirements were waived through the federal regulatory waiver process. However, at this time, the Department of Health has stated that they will use discretion when complying with the following. Okay, so we're still required to maintain the 12-hour annual in-service education requirement for home health aides and the 3-hour semi-annual in-service education requirement for PCAs only where such semi-annual education was due between January and June of 2020. Given the ongoing New York State disaster emergency, the Department of Health will continue to exercise enforcement discretion until the end of the full first quarter following the declaration that the pandemic and the emergency is over. I'm sure that many of you may have been surveyed in the last few months. As we get to the end of the presentation, I think that other providers might be interested in hearing from all of you how that went and if they focused on any of this and if they gave you any further direction. The department has stated that although they are using enforcement discretion, they urge the completion of both the annual and semi-annual in-service for home health aides and PCAs as soon as practicable. So basically that means, they do have the discretion to grant you some flexibility, but they do want to see that you're making an effort to get this done as quickly as you can. Now, in-services can be conducted remotely or through off-site methods. Online in-services may be used as a means of in-service completion, provided it is under the supervision of a registered nurse, that it includes an opportunity for questions and answers, and there is an evaluation that validates the learning took place. So in other words, you can't just put somebody in a room, tell them to take a class and never address it again. It needs to meet these other criteria, which, like we said earlier, is under the supervision of an RN, but almost more importantly, gives them the opportunity for questions and answers and validates that their learning took place. Online in-services must be pertinent to the aide's job responsibilities, and the agency should make sure that they document remote in-service training in the agency's personnel files, and the documentation must be available upon request during survey or any other surveillance purposes. Now, and I'm sure again, I know that I saw a lot of discussion of when this came out because it was something that I think we were all pushing for specifically early on. And in September, the New York State Department of Health issued guidance for PCA training programs and home health aid training programs, wishing to develop a hybrid model of online learning, as it was difficult to bring people into the office for social distancing purposes, but also because, you know, the aides and the administrators were very busy and we didn't have that downtime to provide that education. So there is now a mechanism in place that if you would like, your agency would like to conduct a hybrid model of online training, you are required to submit an agency demographic form, which basically includes agency demographics, the technology platform to be used, the process for IT support of users, your confidentiality provisions, testing procedures, process for scheduling in-person skill assessments, and program monitoring and evaluation. I did not include that form in this presentation, but if anyone is interested and can't get their hands on it, I do have it, and you can send a request to Audacia and we will send it out to you. Again, some more updates, and you know, this is interesting because there really wasn't much that happened from late spring until the fall. But then beginning in September, October, as everyone was gearing up for what we thought would be a resurgence, we've seen a lot of updates coming down the pike. So DOH, to that end, DOH is conducting a survey of all healthcare providers to gain knowledge of the experiences using telehealth during the COVID-19 state of emergency. And I would really, really urge you to respond to this because telehealth is something that home care has wanted to do and to be permitted for a very long time. It really saved a lot of pain and suffering during the peak of COVID. And again now, and actually for myself, I've used telehealth for my doctors because I didn't want to go. So I would urge you to take a few minutes and respond to this survey and provide the experiences, the good, the bad, and the ugly, so that as the DOH begins to craft their post-pandemic policies, they will have your information and not just from their vantage point. This is the link for the survey. You don't have much time to respond. And you can have more than one person from your agency respond because they want to get as much input as they possibly can. So if you have administrators, if you have clinicians, if you have coordinators, whatever it is in your agency, they can all take this link and respond. But just keep in mind, they're asking that each person only respond once, and keep in mind, the survey will close on December 15th. So it's something that you got to get done pretty soon. PPE, well, we've come a long way, or at least we think we have, from the early days where everyone was scurrying around. We didn't have enough PPE. We didn't know where to get the PPE from. But again, you know, lessons learned, and I'm hoping that we don't see a significant shortage again. But New York City has been continually working to compile an emergency stockpile of PPE. And while that is not the place that home care providers are told to go any longer, that's kind of like a last resort, if you will, New York City has partnered with Medline to support the requesting and delivery process. So hopefully most of you know about this and are using this. If you have not found another suitable mechanism to get your PPE, like I said before, the New York City stockpile will act as a last case option, and they're asking that all other options be exhausted before requesting supplies from New York City. I included the link here for Medline. Okay, if you want to make a request for PPE, it's www.medline.com, and you will have it delivered directly to your agencies. That is the phone number that you can call. And just a point of information that if your LICSA is owned by a CHA, the CHA is responsible for ordering through this process. So you need to be able to put your request in with the CHA so that they include that in the ordering process. Again, some more information about PPE, which now has more relevance than it's had in quite a few months. That HCP has also created a PPE portal where providers can purchase commonly used items such as surgical masks, gloves, and gowns at a significant cost savings. This is the phone number for them. And there is also a link that I've included below with a list of additional medical supplies, because as we're going to talk about it, there was a directive that came out regarding eye shields most recently. So here we go to the universal use of eye protection. And earlier this month, actually just about a week ago, DOH issued a health advisory regarding the universal use of eye protection. And they strongly recommend that this eye protection be used by healthcare personnel for all patient interactions in addition to face masks. The advisory observed that wearing both face masks and eye protection provides better and added protection for healthcare personnel who might unknowingly encounter patients with COVID-19. And I guess that's the scariest part. When we know that someone has COVID-19, we're extra careful, but many times COVID-19 doesn't present with many symptoms at all. So we want to make sure and consider, as we've always done before with AIDS, with HIV, AIDS, and other infections, that everybody is potentially infectious. So best that we protect ourselves. Now, DOH did go on to say that the PPE supply shortages might prevent universal use of eye protection in all healthcare encounters. And Judy, I know that you put forth the question the other day about the use of these eye shields, and you were interested in knowing what other agencies are doing. And I think as we move forward in the presentation and get to the end, we'll hear from some of the agencies about what they're doing. But if there are supplies, we should be using them. And if there's not, and there's a shortage, the DOH asks that that these supply shortages be documented, and that we make sure that we reserve the eye protection for patients with known COVID-19 or those exhibiting symptoms or having been exposed. But in a perfect world, they are recommending universal use. I came across some other information, and I don't know how many of you are aware of this, but the Home Care Association of New York State, with the support of a grant from the Mother Cabrini Health Foundation, offers on-demand training for COVID specimen collection, including preparation of the agency, clinician, and patient for clinician and patient, donning and doffing of PPE used in the home, specimen collection procedures, specimen storage and transport, and other necessary information consistent with the CDC and Department of Health recommendations. There were far too many nuances to this program to describe here, but this is the email address. If you are interested in having any of your clinicians in your agency trained for COVID-19 testing, contact COVID-19 at homecareassociationnewyorkstate.org for more information. This is provided free of charge. It's done in a remote learning fashion, and it is available through the end of the year. So if you can, jump on the bandwagon. As we know, even though everyone talks about the need to get COVID tested, even if you're not symptomatic, et cetera, when you look at the lines, and I've been in New York City a few times over the past few weeks, the lines wrap around the block to get a COVID test. So if by having your clinicians trained to do this, it may in fact help some of your staff and help some of your patients. So again, the email address is here, and I urge you to reach out to the Home Care Association, get the information for this, and see if perhaps your agencies can be part of the solution. Vaccine update. Justin, I don't know if anyone's heard about where we stand today. I have not, but the FDA was expected to authorize Pfizer's COVID-19 vaccine as soon as today. And New York is expected to receive an initial allocation of 170,000 doses as soon as this weekend. And, that is great, but 170,000 doses in New York City doesn't go very far. But just to let you know that, we're making progress. The state is setting up 90 cold storage sites as regional distribution centers that are capable of the cold storage at the required temperature, because this vaccine must be stored at very low temperatures. And we don't want to do anything, the state doesn't want to do anything that renders that vaccine inactivated. Now, I know, Judy, you had asked another program about, where do the aides fall? Are they considered essential workers, et cetera? And I took this right from the governor's briefing, that he has a whole outline related to New York's vaccination program. And he talks about healthcare high-risk workers, nursing home residents, and staff being the first New Yorkers to receive the vaccine. So the devil is always in the details. And I know we're all going, so who's the high-risk hospital workers? And based on the definition as of yesterday, and I emphasize that because this is a moving target and it's changing constantly. But as of yesterday, high-risk hospital workers include emergency room workers, ICU staff, and pulmonary department staff. The state expects all high-risk hospital staff will receive a vaccine by the end of this week or next. And other long-term and congregate care staff and residents and EMS and other healthcare workers will follow high-risk healthcare workers. Essential workers and the general population, starting with those who are at the highest risk, will be vaccinated after these initial priority groups. So I would say, disappointing for the home care community. I know, and so much of a reason why we need to remain active, in lobbying and all efforts, because, when you read this, it doesn't even appear that there's an acknowledgement of home care for them to even mention it. I understand, and I think we all understand why hospital workers nursing home residents, okay, are going to be the first to get vaccinated. But the question really remains is, where do home care workers stack up in the pecking order as we move through? So, I would say, as always, we need to keep, active, keep speaking up, keep sending messages. Don't forget, our home care workers, we're taking care of the most vulnerable in their homes, preventing hospitalizations. We already have a shortage of aides out there. We don't need any aides being sick. And please consider, moving them up on the totem pole. And we'll continue to watch and see what happens over the next few weeks in this regard. One thing that I wanted to mention, as far there's several other Audacia updates that Effie is going to do in a few moments, but I wanted to talk a little bit about a big and important initiative that Barbara and I, Effie, the Home Care Association, the American Group Psychological Association, the Office of Disaster Mental Health, the City of New York, have been working on since, I guess it's been June or so. And some of you might recall, in fact, some of you may have been on the roundtable discussion early on in June, when HCA sponsored this discussion that talked about the need for recognition for the aides and home care workers, and talked about their resiliency or not, and the need to make sure that throughout this pandemic that we were actually taking care of our home care workers. So based on the feedback that was obtained during this roundtable discussion, and again, many of the home care administrators from throughout New York City and New York State were on this, we wanted to know what the mental health needs of home health aides and agency workers were during, and I said here during and after, but we're still in the midst of this. I mean, things have slowed down a little bit throughout the summer, and gave us all a chance to breathe and maybe regroup. But I think the fear is still there. The anxiety is still there. And we talked about the needs of these home care workers who often are overlooked, and felt that they could benefit from some structured groups to address their psychological needs. And we actually tagged on to the end of a program that was offered by New York State, and we're actually able to enroll a few aides into this program, where for a 6-week period of time, they had a 45-minute call with a social worker who actually focused the discussion around recognition, resilience, etc., and trauma related to the work that they were doing. And the aides that participated loved it. They actually gave it a 5-star rating. They felt that they could use more of it. They felt that even though sometimes the content of the discussion was tough and it made them sad and anxious, that they got comfort in hearing that there were other aides that felt the same way. And the social worker that headed up this small group actually provided them with some strategies for stress reduction, etc. And it was just a whopping success. So we use that to inform us. And presently, we're working with HCA and the American Group Psychological Association and developing a 90-minute program for aides and agency administrators and coordinators. Again, to talk about, how COVID has affected them, what were some of the challenges, both professionally and personally, and provide them with some tools on how to handle the stress and give them some resilience building strategies. We're in the process of reaching out to agencies, and thank you to those agencies that have submitted the names of aides, and I've been in touch with all of them, and they're very excited to participate. We'd like to have another 10 to 15 aides that participate in this 90-minute session, which at this point will probably be held early January. We've determined that the best time of that day to do this would be early evening. So for the most part, it would not interfere with their work schedules. Each session will be limited to 25 to 30 participants, and it will be held via Zoom. We will help get everybody set up on Zoom, although I think we have some hesitation with the aides using this, but the aides that we had using this before did a remarkable job and adapted to it very well. One of the reasons that, aside from the obvious on why we felt that this was so important, is that we think that the better connection we have with the aides, the more the aides feel that we are concerned about them. And when I say we, it's all of us, that, you know, we might be able to help with the aide retention, which I know in some agencies is a huge problem, and we can't afford to lose any aides. We need those foot soldiers on the ground, and we need to take care of the aides and help them through this very traumatic journey that they're in. And they're really working alone out there. You know, there's been so many different publications and articles that have talked about the psychological aspects of COVID-19. There was just recently the other day about children, and it's affected everybody. And the aides and home care workers particularly are really on the front line, but they're alone. They don't have anyone, like they're in a hospital where they can go into a corner and cry. You know, they're on a fast track. They just need to keep going. So we're hoping that you can reach out to the aides. We do have some materials that we can share with you to introduce this to the aides, and then have them get back in touch with us in the next week or so, hopefully before Christmas. And we will reach out to them, explain exactly what the program is. There hasn't been anyone that I've personally spoke to that didn't say, oh my God, thank you so much. We really appreciate that you're thinking about us. So if you wanna give a good holiday gift to some of your employees, reach out, offer them the opportunity to participate in this. They will be paid for their time. So it will be 90 minutes of their time that they will be paid for. And following the 90-minute session that we hope to have in the beginning of January, we want to offer a similar 90-minute session for agency administrators and coordinators, because we want to let you all know what we've shared with the aides so that you can also reinforce it with the aides. And hopefully down the road, perhaps we can provide some of the materials and you can sustain this type of program within your organization. Okay, so this is the end of my presentation, but I hope to be talking to you at the end. And at this time, I'm going to turn this back over to Effie, and she will talk about some of the great Audacia programs that we want to make sure you know about.
Thank you, Anne. Thank you so much for the informative presentation and for connecting us to all of the current information. We will take some questions in a couple of minutes, so I encourage all of you to use the chat box so that we can hear from you. Those of you that participated in our live training events that were held at our offices as well as at locations throughout the city and the state at either your facilities or various remote locations. We really miss seeing your aides. We really love training the workforce. Obviously, that's what we do, but we really we miss that live interaction. So obviously being here online, it's not a perfect opportunity, but it's a way for us to stay connected. So what we do have, what we have developed, it follows the theme of our live training is online training for VBP measures. It's for HHAs, PCAs. It covers a variety of the VBP potentially avoidable measures. The content is custom developed. It really takes, just like our live training for those of you that were participants, takes the material and all of the information that's available and it translates it into a very easily understandable format for the home health aides and PCAs so that it's very specific to what their responsibilities are. And so we really pride ourselves. We have a great team that spends an incredible amount of time developing the content. So it is custom created. It's available in multiple languages. There is no cost between now through the end of March for any agency to participate, to sign up. And there are incentives such as replacement costs or extra payment for your staff to complete these courses. So we encourage you to take advantage of that as that's part of the WEO funding that allows this. Additionally, if there are agencies that are really very concerned, as we know many are, with the in-service requirements and feel the burden of needing to adhere to that schedule and those minimum requirements. This menu of online courses can also be used for some of your in-service training as well. If you're using it for in-service training, you cannot access the replacement costs. That is one of the Department of Health mandates that you need to be aware of. So we look forward to hearing from you if there's an interest in our online program. I think there's another slide, if someone could advance the slide. Okay, so this is just some of the courses that we have that are available online. Many more coming up. These that are available again in other languages. So feel free to reach out. Is there another slide after this? I'm not certain. Oh, here are some important links that Anne referenced earlier in the presentation. So please feel free, obviously, these are, I'm sure, are familiar to all of you to reach out. That concludes our formal presentation. We would like to open it up for questions. We also have an email that you can send in addition to reaching out directly to our staff about any questions you have about COVID. But let's go into the chat box. I know that there were some questions in there. First, a comment, some very new information that we just learned from a different webinar that some of our staff attended that was related to nursing homes, but does have relevance to home care providers. So in today's webinar for nursing homes regarding the vaccination implementation, Dr. Zucker discussed that because this is an emergency use authorization, or EUA as it's referred to, the vaccination would not be mandatory. It will be a consent-based vaccination. So the Department of Health should be publishing an FAQ, and it will obviously address some of these questions related to vaccination requirements for all providers. So that's some new information. Now, let's go to questions. We have a question regarding waivers. Can you discuss the waivers for in-home supervisors of caregivers and in-home visits for clients?
Hi, can you guys hear me?
Yes.
Okay, so I don't believe at this point that anything has changed. There was a waiver that was granted early on in the spring where those supervisions could be done remotely. Now, I just want to point out that this wasn't done to, in any way, shape, or form, to usurp an agency's authority or the need to supervise their aides. Okay, it was done as, you know, a health type of thing. So I would suggest that where you can, that you supervise your aides in the home. And if there's a concern about doing an aide supervision in the home because of COVID or some other situation, that you can do it remotely, but you should be documenting that that was a remote supervision, and make sure that your supervisors in your office are able to get out into the community at least periodically, and maybe not as often as we would pre-pandemic, to supervise that aide. But based on the information that I have at this time, I do believe that you can still do it through telehealth, an aide supervision. And when we say telehealth, that could be something as simple as a Skype, a FaceTime, or a phone call.
Okay. Thank you. Next question. Will this be available for rewatch later? And will there be hard copies of slides provided as well? Yes to both of those questions. We can send hard copies of the slides as well as make it available for viewing separately. Okay, so next question. Good afternoon. Here's a question regarding DAL for annual health assessments. The verbiage is annual health assessment. Does this mean annual physical exam done?
No, it does not. An annual health assessment has certain components. It is outlined for the LICSs of what that includes, and it can be done by a nurse in the office. It's a checklist, it's a questionnaire. They should still be getting their you know, annual TB test, but it is not a physical exam.
Okay, thank you. Next question. Was there any mention of private duty aides being able to get vaccinated if they work in a facility and are not a staff member of the facility? I had a client's son inquire about this today.
I have no idea. And
Private
like I
duty
say, I think that the information about AIDS is a little bit lacking at this point. But if you're working in a facility, you may fall under the auspices of what that facility's policy is, and in fact, get vaccinated. You know, I know there's a whole pecking order of how people in facilities are going to get vaccinated, because there's, with 170,000 vaccines, there's just not enough
Right.
for every worker in a facility and resident in a nursing home to get vaccinated. So there's a whole pecking order on how that goes. But we will continue to keep abreast of this ever-changing situation and send out updates as they become available, because the news is breaking every day.
Mhm. Right. And we anticipate the Department of Health will issue guidance. They're also figuring this out as it evolves based on, and as you said, the availability of the vaccine, and prioritizing the high risk healthcare workers. So we will, I know the Department of Health will communicate directly with agencies. These are all great questions. We have another question. Are we still allowed to do reassessments via telehealth?
I have not seen anything. The updates that I provided today were the full array of updates that I have seen. And that's combing through, CMS, DOH, HCA, HCP sites. So I have not seen that they have lifted that. Again, I will go back and double check, because I always want to make sure that you do have the most up-to-date information. However, I have not seen anything that said that you cannot do reassessments via telehealth. But again, I want to urge everyone to just consider that it shouldn't be just done as a convenience measure. There should be really some rationale on why we're doing this via telehealth versus inpatient. Okay, if it's, if we're short of staff because people are out sick, because we have a lot of aides that have COVID, or there's an added risk in the patient's home, I think we document that and we do the reassessment via telehealth, because there's good justification for it.
Right. There's a comment on the chat. We go in if we can, but some patients do not want you to go in.
Exactly. And
So that does
again,
impact, right?
right, I would document that as the reason the patient needed the service because of X, Y, and Z. We didn't want to refuse providing the service, so instead we honored the patient's wishes within the confines of the waiver, and did the reassessment remotely. But like that's what I'm saying. If there's a good reason, and I know now people are getting more skeptical again. For a while, things lightened up. Now everybody's starting to hunker down again, and and rightly so. I mean, the number of cases that we're seeing daily is really frightening. So, as much as we can limit, person to person interaction, but also keeping in mind that wearing a mask, if you have N95 respirators, healthcare workers should be wearing those, wearing the eye shields, proper hand washing will also limit the spread of COVID if you do that. Okay, it's shown to be very, very effective. But if there's a breach in any of those things and you're out at a patient's home, the risk of contracting COVID and spreading it is very, very big.
There is a question that we didn't address yet related to eye protection that I would like you to address, Anne.
Sure.
It's about a recent health advisory from the Department of Health on the use of eye protection. The question is, we're only currently providing eye protection to our HHAs who are taking care of positive COVID patients. They wanted to know what other agencies are doing, as they have not experienced any HHAs who have gotten COVID from a patient.
Right.
So,
So So we did talk a little bit about that, and the advisory from the DOH suggests that the healthcare workers do wear, for any patient that they're taking care of, that they do wear the eye shields. But the DOH also recognize that there may be a supply and demand issue with that, and that certainly those that are taking care of patients with COVID and those that have been exposed to COVID should absolutely 100% have it. But if there is availability for other healthcare workers to get the eye shields, that is considered to be the best practice. But if there's a shortage, document the shortage, but make sure those that are at highest risk do have it.
Okay, thank you. We appreciate that.
I wanted to, I know that in the vein of Judy's question, and Judy, I hope you're still on the line. We'll actually see you in the chat window there. I know that you asked what other agencies were doing, and I would love to hear from some of the other agencies as to what they are doing in this regard. Are they providing their the eye shields to all of their healthcare workers, all of their aides? Or again, do you have a shortage of them or some other issue that is precluding you from providing them to everybody that's out there working with patients? Anyone care to share?
We have another question in the chat box. While we're waiting for people to respond, the question is, please clarify the 10-day versus 14-day quarantine of clients that are positive and are about to be discharged from the hospital.
So, you know, again, like we've alluded to earlier, this is a constant, ever-changing scenario. So initially it was 14 days. Now the CDC has come out with information that says they only need to quarantine for 10 days. Now they're also saying that if healthcare workers have COVID and they're taking care of COVID patients, they could go and work with the COVID patients. So I think, you know, you use what the CDC guidance is, but all of you should have your own policies and procedures which address this and which give you some level of comfort to work with. And I would go with that. You know, just on a personal note, you know, I think, you know, a lot of people are going with the 10-day piece because people don't want to be, you know, cooped up for 14 days, et cetera, et cetera. But if you can, you know, quarantine for 14 days, I don't think it would hurt. But again, based on the CDC, they've loosened that to 10. So always changing.
Thank you, Anne. We did see in the chat, some of you did respond that we heard from 4 agencies that yes, they are providing face shields at this time. And obviously there should be cleaning and reusing protocols. That seems to be some of what we're hearing. Some are saying they're giving it to aides who have worked with clients that were positive. So there are some variations. So it does appear to be, it appears that most of the, yes, it does appear that most of the agencies are giving the face shields to all workers.
Yeah, that's great. That's great to hear. You know, again, I think as healthcare providers, we want to be part of the solution and not part of the problem, although recognizing that there could be a shortage, there's an additional expense, but there's also a huge expense when people are out sick. when people leave your employment because they don't feel that they've been given the proper protective equipment, and then you have to replace them. So to the best that we can operate, and protect our workers and let them know that we're doing everything in our power to make sure they're safe, I think that goes a long, long way.
Mhm. Right.
I just wanted to reiterate about the mental health program that I spoke about earlier. This slide presentation will go out to everybody. There's also an email address that you can send any questions to that is on the last page of the presentation. Either one, the email address on the presentation that actually directs any interest of aides to myself, or the Audacia Foundation COVID response. Please try to get a few aides that you think would benefit from this most. The aides that I've spoke to are more in need of this type of program and service than any of us really know, because I don't think by and large we've had the time to sit down and talk to them. When I've called them or they've called me, I've actually sat and spoke to them at length. And I know Barbara has done the same, and it's pretty heart-wrenching to hear some of the stories of what they've been through, and that they really don't know where to turn. And there are a lot of resources out there, but I don't see that the aides on their own are going to reach out to get them. So this is a way for us to identify, begin to offer them what they may need, and then it can grow exponentially from there.
Thank you, Anne. I hope people take advantage of that. There is one other question. It's regarding consent. Please advise on consent signature policy when visits done telephonically.
Right. So I don't think, I mean, generally unrelated to the pandemic, I don't think there's anything special about this, but you should, generally speaking, your agencies, you should have a policy for telehealth, telephone visits, etc. And there should be a consent that the patient signs or does a verbal consent for this. Okay, so it doesn't necessarily fall under, or can be included in your general consent. It could have a provision in there that if visits are done, telephonically, I consent to this, blah, blah, blah. But it should be addressed somewhere, either in a separate consent or in your general consent. And I want to also highlight something that I said earlier, several presentations ago, because the federal government and the state have granted waivers for telehealth. And they've done things like saying you could use Skype, which isn't necessarily HIPAA compliant. You could use FaceTime, which isn't HIPAA compliant, etc. They've done that because they wanted to ease the burden for what was going on. But we still have a responsibility as a healthcare organization to protect the patient's health information and confidentiality. So if you're going to have someone conduct a telehealth visit, don't have them do it in the living room with all your other family members there. And I know that some of that's difficult now because a lot of people are working from home and we have our families around us, but we still are bound by those same regulations of ensuring that our patients' confidentiality is maintained, even though we've changed the mode of communication. So just want to highlight that.
Mm-hmm. Right.
Sorry, I'm having trouble hearing you.
I don't know.
That was my watch
What
talking.
that was.
I don't know why.
I just, there's two final, actually they're just comments in the chat that I'll read, and then I see it is 2 o'clock. So we recognize how valuable your time is. So we'd like to conclude. Last two comments are that they're usually regarding consents. One agency said we mail them to the patient or we'll stop by. Right, one said they mail a copy along with the plan of care. Another one said they mail them or stop by and obtain the signature from the outside door. And then finally, someone agreed 100% about efforts to take care of patients and caregivers. So hopefully you've all had a chance to look in the chat and see those questions and comments. I want to thank you, Anne, once again for being with us today. And I want to thank all of our providers. We will continue to be in touch about information, and hopefully you'll reach out to us with any questions or comments. Thank you very much, and enjoy the rest of your day, and safe and healthy holidays to all of you. Thank you, and bye-bye. Thank you.
Thank you. Bye.